How AI is quietly changing healthcare. When we think about healthcare, we often picture the most human moments. A doctor diagnosing an illness, a nurse caring for a patient, a surgeon making a life-changing decision. So when people talk about artificial intelligence transforming healthcare, many imagine robots replacing doctors or machines making medical decisions all on their own. But that's not what's actually happening. The real story is much quieter. AI isn't taking over hospitals overnight. Instead, it's slowly reshaping how healthcare works from behind the scenes in ways most patients will never see and many professionals barely notice day to day. And the surprising part is this: AI didn't start in the surgery room or with dramatic breakthroughs. It started with paperwork. Healthcare produces a massive amount of information every single day. Patient histories, lab results, imaging scans, prescriptions, insurance records, appointment schedules, and clinical notes. For decades, managing all this information has been one of the biggest challenges in medicine. In fact, doctors often spend nearly as much time documenting care as they do providing it. This is where AI quietly entered the system. Today, AI tools can listen during patient visits and automatically generate medical notes. They organize records, summarize conversations, and update charts in seconds. To the patient, nothing looks different. The doctor is still there, listening and talking. But for that clinician, hours of administrative work can suddenly disappear. The change isn't dramatic, it's incremental. And incremental change is often the most powerful kind. Another place AI is quietly transforming healthcare is medical imaging. Radiology once depended entirely on human interpretation, with specialists examining X-rays, MRIs, and CT scans, image by image. Now, AI systems can assist by scanning those images first, highlighting areas that might need closer attention. They don't replace radiologists, they act more like a second set of eyes. AI can flag tiny patterns that a human might overlook after hours of reviewing scans, helping doctors prioritize the most urgent cases faster. The goal isn't automation, it's assistance. And that distinction matters, because healthcare isn't becoming less human, it's becoming more augmented. AI is also changing healthcare long before a patient ever enters a hospital. Predictive systems analyze patterns across large populations to identify risks earlier. Hospitals can now estimate which patients are more likely to develop complications, return after discharge, or require additional care. Insurance providers use AI to detect unusual billing patterns or potential fraud. Public health systems analyze data trends to anticipate disease outbreaks or resource shortages. Most of us never see these systems, but they influence how resources are allocated, how quickly patients are treated, and sometimes even how care is prioritized. Healthcare decisions are increasingly supported by probabilities instead of just guesses. At home, AI's presence is even quieter. Smartwatches track heart rate irregularities. Apps monitor sleep patterns. Devices analyze activity levels and breathing trends. These tools don't diagnose disease on their own, but they create continuous streams of health data that never existed before. Healthcare used to happen occasionally during appointments. Now it happens continuously in the background of our daily lives. The relationship between patients and healthcare is slowly shifting from being reactive to being preventive. Instead of asking, what went wrong, the system is beginning to ask, what might go wrong soon? For healthcare professionals, AI is also reshaping workflows in subtle ways. Scheduling systems predict appointment lengths. Staffing tools forecast patient demand. Supply chains anticipate shortages before they occur. Even hospital bed assignments can be optimized using predictive algorithms. None of this makes headlines, but it changes how efficiently hospitals operate. And efficiency in healthcare doesn't just save money. It can save time, reduce burnout, and improve patient outcomes. Many clinicians don't feel replaced by AI. They feel supported by an invisible infrastructure working in the background. But these changes also introduce new and important questions. When algorithms help prioritize patients, how are those decisions being made? When AI analyzes our health data, who owns that information? When systems learn from historical medical data, do they also inherit historical biases? Healthcare has always required trust. As AI becomes a bigger part of medical decision-making, transparency becomes just as important as accuracy. Patients may never see the algorithm, but they are affected by its recommendations. The challenge moving forward isn't whether AI will be used. It's how responsibly it will be used. One of the biggest misconceptions about AI in healthcare is that the change will arrive suddenly. In reality, the transformation is happening layer by layer. A few minutes saved here, a faster diagnosis there, a better prediction somewhere else. Each improvement feels small on its own, but together they reshape the entire system. Healthcare isn't being replaced, it's being rewired. Perhaps the most important shift is philosophical. For most of history, medicine has focused on treating illness after symptoms appear. AI introduces the possibility of earlier awareness, of identifying patterns before humans can recognize them. This doesn't eliminate uncertainty, but it changes the timeline of care. Earlier signals can mean earlier conversations, earlier monitoring, and sometimes earlier intervention. The doctor remains central, but the information surrounding that doctor becomes smarter. So, what does all this mean for you, for everyday people? It means your healthcare experience may slowly become more personalized, more predictive, and more data-driven. Even if your appointments look the same on the surface, you may wait less time for results. Risks may be detected sooner. Your doctor may spend more time looking at you and less time looking at a screen. The changes won't feel revolutionary, they'll feel normal. And that's exactly how technological transformation usually happens, not through sudden disruption, but through quiet integration. Artificial intelligence isn't replacing healthcare professionals. It's reshaping the environment they work within. It's reducing friction, reorganizing information, and helping humans make better decisions in increasingly complex systems. The future of healthcare may not look like science fiction. It may simply feel more efficient, more informed, and more connected. And most people won't notice the moment it changed, because it already has. This is Work, Life, and AI, exploring how artificial intelligence is changing real life, one quiet shift at a time. Thanks for watching, and be sure to subscribe for more.